Hello everyone. Today, we're delving into the world of a medication called Divalproex, commonly known by its brand names Depakote and Depakote ER, with the generic name Divalproex sodium. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Divalproex, known by its brand names Depakote and Depakote ER, is an oral medication primarily used to treat seizure disorders, bipolar disorder, and migraine headaches. It belongs to the class of anticonvulsant drugs and mood stabilizers. Approved by the FDA, it has been in use for various conditions since the 1980s. Divalproex works by increasing the levels of gamma-aminobutyric acid, GABA, a neurotransmitter in the brain that helps to calm overactive nerve signals. This mechanism aids in controlling seizures and stabilizing mood in individuals with bipolar disorder. Additionally, it helps prevent migraine headaches by reducing the frequency and severity of attacks. Divalproex is often prescribed in conjunction with other medications or therapies to manage these conditions effectively. Warnings: Divalproex comes with its set of precautions. It's not recommended for individuals with liver disease, as it can cause severe liver damage, including liver failure, especially during the first 6 months of treatment. Pregnant women should exercise caution, as Divalproex can increase the risk of birth defects, particularly neural tube defects like spina bifida, when taken during the first trimester of pregnancy. It's important to discuss the potential risks and benefits with your healthcare provider if you're pregnant or planning to become pregnant while on this medication. Furthermore, individuals with a history of pancreatitis should use Divalproex with caution, as it may increase the risk of pancreatitis recurrence. Before taking this medicine. Before starting Divalproex, several factors need consideration. It's essential to inform your healthcare provider about any allergies you have, especially to medications like valproic acid or valproate sodium. Individuals with liver disease, a history of pancreatitis, or a family history of genetic disorders such as mitochondrial disorders should discuss potential risks and benefits with their doctor. If you are pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider, as alternative treatment options may be considered. Regular monitoring of liver function tests and blood levels of Divalproex may be necessary during treatment to ensure safety and efficacy. You should not take Divalproex if you have liver disease, a urea cycle disorder, or a genetic mitochondrial disorder such as Alpers-Huttenlocher syndrome. Before starting the medication, inform your doctor if you have a history of depression or suicidal thoughts, kidney disease, HIV or CMV, cytomegalovirus, infection, or if you are on a low-sodium, salt diet. It's also essential to let your healthcare provider know if you drink alcohol very often or if you have ever had pancreatitis. If you are scheduled for surgery or certain diagnostic procedures, inform your doctor as you might need to adjust your medication regimen. Side effects: like all medications, Divalproex can cause side effects. Some common side effects include nausea, vomiting, stomach pain, dizziness, drowsiness, hair loss, changes in menstrual periods, and weight changes. These side effects are usually temporary and may improve with continued use or dose adjustment. However, more serious side effects may occur, such as liver problems, pancreatitis, suicidal thoughts or behavior, low platelet count, thrombocytopenia, and allergic reactions. If you experience any unusual symptoms or side effects, it's important to contact your healthcare provider immediately. Interactions: Divalproex may interact with other medications, including certain antidepressants, antipsychotics, antiepileptic drugs, and blood thinners. It's essential to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Additionally, Divalproex may affect the levels of other drugs in your body, so dose adjustments may be necessary. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Divalproex. The dosage may vary depending on the condition being treated, your age, weight, and other medical factors. It's important not to exceed the prescribed dose or suddenly stop taking the medication without consulting your healthcare provider, as this can increase the risk of seizures or mood swings. Your doctor will monitor your response to the medication and may adjust your dose accordingly. Avoid: while on Divalproex, it's advisable to avoid alcohol, as it can increase the risk of side effects such as drowsiness and liver damage. It's also important to avoid activities that require mental alertness, such as driving or operating machinery, until you know how the medication affects you. Staying hydrated and maintaining a healthy lifestyle can help minimize certain side effects of Divalproex. FAQ. Many wonder about the age restrictions for Divalproex. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Divalproex. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.